Hello, my name's Sandra and I work for the Bristol Breastfeeding support team. I'm a breastfeeding counsellor and a lactation consultant, and the team is funded by Public Health through Bristol City Council, and we're managed by South Bristol Children's Centres. So I wanted to talk today about paced bottle feeding. It might sound strange when a breastfeeding supporter wants to talk about bottle feeding, but we recognise that bottle feeding can be a part of many breastfeeding journeys for all sorts of reasons. It might be that the family intended to always use bottles as well as breastfeeding. Some families like to express and bottle feed, and sometimes families find that breastfeeding doesn't get off to the best start and they temporarily are giving additional milk with a bottle while they work on whatever the breastfeeding challenges are. So if you are struggling with breastfeeding at the moment and you're bottle feeding, this is definitely a video for you. This technique is something that we've used for a very, very long time in the breastfeeding world, and back in the day this video would be titled Bottle Feeding the Breastfed Baby. In more recent years, this technique has become widely recognised as a very appropriate responsive technique to use with any baby that's being bottle fed. So if you are intending to fully bottle feed your baby, maybe you're pregnant, it's the lockdown, you've got nothing much else to do, so you're clicking on lots of videos, you're very welcome. If you're thinking of doing any kind of bottle feeding, this is a good video to watch. So the technique is called paced, which means that we pace the feed. We make this a more leisurely dining experience for the baby, often as it would be at the breast. So with breastfeeding, the baby is more able to control the flow of milk. The baby does the work really. When the baby latches onto the breast, the baby elicits the flow of milk and will normally feed until they're full and then they stop. And so with this paced bottle feeding technique, we are trying to do the same thing. We're trying to help baby learn to stop when they're full rather than trying to make them drink every last drop. The type of bottle feeding that most of us probably have seen, certainly growing up and even in more recent years, is to have the baby almost flat on their back and with the bottle tipped up like this, and with perhaps a real emphasis on making sure the baby has every last drop so as not to waste any, and maybe it's thought that the more they drink the longer they'll sleep. So we're going to try and avoid this. We now recognise that this is not a great experience for the baby, and it can also lead to overfeeding, which we know that this can cause problems in later life. The way our eating habits as little people can really have an impact on our eating habits as adults. And we do have a bit of an obesity problem in the UK, don't we? And so there's a lot more emphasis now on looking at how babies are fed in the early weeks, months, years, to try and avoid problems later on. So we're going to look at paced bottle feeding. We're not going to tip the bottle up. What we are going to do is put the baby in a slightly more upright position, so perhaps it could be cuddled in the crook of your arm but sitting up, and then we're going to take the bottle and we're going to feed the baby with the bottle in a more of a horizontal line rather than like this. So you don't need to fill the teat. The teat just needs to have milk at the end of it where the holes are so that the baby can drink it. It doesn't have to be like this. It doesn't mean that they're going to take in lots of air. It doesn't mean they're going to be more windy. In fact, if anything, this technique will reduce indigestion and colic because the baby is going to be able to drink a little bit more slowly. So if we bolt our food, if we eat everything a bit too fast, that kind of feeling afterwards is not very comfortable. It can be the same with this. If the bottle is tipped up and the baby has no choice but to just keep drinking, they're probably going to get indigestion. So it's not natural. That's not how we normally eat or even drink. We wouldn't normally knock a drink back in one go, unless we're having a drinking competition perhaps. We would normally drink a bit and put it down, and then we might drink a bit more and put it down. This is the style that we want to use with our babies. It's pretty much what happens with breastfeeding. They feed for a bit, and then they might come off a bit, and then they might go on for a bit, and then they might come off a bit. They'll swap sides, so they might feed on one side for a while, then they come off and swap over to the other side. So we're going to try and incorporate all of that in the bottle feeding experience. So we're having the baby in the upright position. We're going to hold the bottle a bit more horizontally. Some families will touch the baby's nose, mouth, just to try and get them to open their mouth wide, a bit like you do with breastfeeding. People talk about the landing strip there, about resting the nipple on the landing strip, and then as the baby opens their mouth and tilts their head back, then the nipple can go in. So you might like to try that with the teat. Just touch the top lip, try and help baby open their mouth a bit wider. Some people will just maybe touch the cheeks with their fingers. So skin to skin contact is what can really stimulate a baby to want to open their mouth wide and latch on. So you could perhaps just do that. But however you're going to do it, eventually the teat's going to go in, and you're going to hold it horizontally like this. So there'll be some milk at the end of the teat, but the teat won't be full. Now if the baby is happy and is able to drink like this, then that's great. You may find you don't need to tip the bottle until towards the very end of the feed. If baby's going right to the end of the milk that's in there, you might need to tip it up so the baby can get it. If your baby is struggling to suckle milk, some babies struggle with suckling. That's why you have an issue sometimes at the breast. The baby is just not great at suckling and getting the milk out, and sometimes it'll be the same on a bottle. So with those babies you might need to tip it up a bit, at least just to get baby going. These issues with suckling are usually temporary. It's how do we just help baby get a bit more milk while those temporary feeding issues are being resolved. So we're there with the bottle horizontally, and baby's sucking and drinking, and hopefully looking quite relaxed. Might be looking at you. The baby might be looking at a wall or something you can't even identify. But as long as they're relaxed, then this is going okay. When babies are feeling a bit stressed, that they're feeling maybe the milk's flowing too fast or they just need a break, they will often frown. So, make that kind of face. So that's sort of telling you I'm not having a great time here. I'm struggling a bit. So at that point, that might be your cue to give the baby a break. So you've been feeding for a little while, the baby starts frowning, and you just tilt the bottle down. You don't need to take it out of their mouth, just tilt it down so it's on their lip. They know it's still there, but they're not drinking. Some babies will pant. Let them do that. Just have a little breather, and then off you go again. Some babies, frowning will be your first kind of clue that they're not having a great time. So if you haven't sort of seen that happen, babies that really wanted to stop will often put their hands out. So, it's a very clear stop. Or they'll move their head, trying to get away from the teat because it's too much. They need a break. So that's something you could be looking out for. If you're not sure about all of that, or perhaps to begin with, you could count. So count 4 or 5 sucks, and then give the baby a break, and then off you go again. So some parents will start counting because that feels like a fairly good way to do things, and then the more they get to know their baby, they'll know by the facial expressions as and when baby needs a little break. Some families will also choose to swap arms partway through the feed, as you would with breastfeeding. So the baby has a different view for a little while, and then we'll carry on the feed there. So we're trying to encourage the baby to drink at a reasonable pace for them, to have a break, not to just keep swallowing and swallowing and swallowing. And we want them to kind of feel when they're full. So when baby seems to have finished, even if there's some milk left, try not to worry about that. It's okay if they leave some. So what you could do is finish the feed as far as you feel the baby is telling you. Then you might like to do a bit of winding. We're quite obsessed with wind. In the UK, we love to do winding. This is often grandma's job, but in the lockdown, you might not have grandma with you. So a little bit of winding, and then if the baby kind of comes to, then you could offer a bit more milk again and see if they do want a little bit more. But if they don't, that's fine. The volume that's suggested on the side of the formula tins often doesn't work very well for new babies, particularly if you're working on breastfeeding. They take little and often. That's what they're designed to do. New babies drink little amounts but very frequently, and so you may find that the baby really doesn't drink very much at all, but is then hungry again sooner than you might have expected it, and that's a normal way of feeding, and it may mean that you end up wasting some milk. So apologies for that. It can be perhaps, you could think to not put loads in the bottle in the first place, and then perhaps there won't be quite so much waste. But by using this technique, even if you've got loads of milk in there, they should then only drink what they need. So we know that with formula milk, that encourages the baby's tummy to expand more rapidly than it would with breast milk. So if you're using formula, whilst obviously we want the baby to be fed, the baby needs milk, we want to try and avoid tipping and trying to get the last bit in, because they may not need it all. And all that will happen is that their tummy will expand and they'll want more and more and more. And we're trying to keep to a sensible amount that's right for the baby's tummy. Most babies, their tummy is about the size of their fist. In fact, most adults, I think our tummies are meant to be the size of our fists. That's why they talk about a food portion being the size of your palm. I know. So we don't want to be throwing loads of milk in. And whatever we're doing with this, we want it to be a slower pace, not like this. And we don't need to be worrying about wind all the time. If they've got wind, it'll come up or it'll be pushed out, one or the other. And pacing the feed will help avoid that awful indigestion feeling that any of us get if we bolt our food. So I hope that's been useful. If you are breastfeeding and having to do a bit of bottle feeding and you're wanting to get back to breastfeeding, maybe this isn't what you'd planned, this wasn't quite how you expected things to happen, there is help out there. So you can get in touch with the Bristol Breastfeeding Support Service, either through Facebook, there's a couple of places there, or you could go to the South Bristol Children's Centre Hub website and you will find us there. Facebook-wise, Bristol Breastfeeding is an information page which will offer tips around breastfeeding and also tell you where the support is. So all the breastfeeding groups at the minute in Bristol are virtual, so they're mostly done through Facebook. So Facebook's probably the best place to be for breastfeeding support at the moment. So Bristol Breastfeeding is the page with lots of information. Bristol Breastfeeding Mummies is a group, a huge breastfeeding online community with mums from Bristol, South Gloss, North Somerset, that kind of area, all there to support one another, and there are health professionals and breastfeeding supporters on there as well to either help through that group or point you in the right direction. We are able to offer this kind of service in some instances. We can do visual, virtual visits. We can't do home visits, but we can talk to you like this. So if you are needing help, please don't sit at home and feel that there isn't any and you can't get any help. Please come onto Facebook and find us. So Bristol Breastfeeding Mummies group and the Bristol Breastfeeding page. Stay safe, everybody. Bye-bye.